I can see that we have around 25 attendees who have joined us. While we wait for others to join, we'll start formally with our session. Good morning, good afternoon, wherever, depending on wherever you are in the world. And I welcome you all to today's webinar. So this webinar is brought to you by Shaukat Memorial Cancer Hospital and the Global Health Network at the University of Oxford. Today, we plan to introduce the Global Health Network Pakistan initiative to you all, which is part of the network's research capacity building initiatives. And Shaukat Khanum is pleased to be a part of this activity. My name is Mariam Hassan, and I'm a clinical research administrator at Shaukat Khanum. And I am delighted to be joined today by my colleague and friend, Dr. Farah Asif, who's the head of clinical research at Shaukat Khanum, Dr. Salvia Zishan, who's the regional manager for the Asia Knowledge Hub at the Global Health Network, and Bonnie Baker, who's the regional lead for the senior manager for the regional programs at the Global Health Network. We are supported by the IT team led by Louis at the Global Health Network, and we are grateful for his behind the scenes support for us. So a little bit, I've introduced the speakers, a little bit about our agenda for today. If we can move to the next slide. The goal is to introduce the Global Health Network as an entity, as well as the TGHN Pakistan page to you all, and how this particular page is as a space for collaborative activity for all of us. We'll give you an overview of various knowledge hubs, as well as knowledge generation and knowledge sharing tools across the network, and how to connect and collaborate on this, as well as various resources on TGHN and how you can make use of them. It's important while we share this information to reiterate to everyone that this space is for all health researchers, led by health researchers, and is a collaborative open space with no gatekeeping involved. And the true success of this this activity is when we all come together on this and share our work with each other. So a few housekeeping rules before we formally begin with our presentations. Just to let everyone know, this session is being recorded, and the recording will be available to all of you with the relevant materials that you can go through at your ease. The links that we will share throughout our presentations will be given in the chat box as well, so you feel free to scroll through them while we go through these details. If you wish to interact with us and the other panelists, please feel free to type in the chat box or in the Q&A session. If anyone wishes to ask a question, you can raise your hand, but that is going to be at the end of our discussion. So in the interest of time, during the presentations, we will only be taking questions through the chat and Q&A feature. And at the end, we will have some dedicated time for you all. And those of you who would like to ask a question can raise a hand, and we can then unmute you. If any questions remain unanswered, we will be happy to share responses to you with all of you in writing. There is the chat function also for any technical issues that you face, and our network team will be happy to figure those out for you. So we can now begin the program for today. Firstly, I'd like to welcome Bonnie Baker. She is the senior program manager for the regional programs at TGHN, and somebody with extensive experience in global health research and capacity building. Over to you, Bonnie.
Thanks, Mariam. Thank you very much to Dr. Asif and Dr. Hassan for inviting us to be part of this session. We're delighted to be here and to be engaging with so many of you as well, and hopefully working with you more closely moving forward. So I'm just going to give a very brief overview of the Global Health Network, and that should place some of our other presentations coming up in more context and provide a bit of a basis for discussion for us all as well. So the ethos of the Global Health Network is about building better equity in where research happens and who benefits. And the aim of this is to essentially enable anybody, anywhere doing research to have access to the same capabilities to do that research as anybody else in the world. And giving them the skills, but also the access to tools and methods and resources, and to some extent, most importantly, each other. So something that has been talked about for decades and may be quite familiar to some people on the call is this concept of the 90-10 gap. And what this means is that 90% of research only benefits 10% of the global population. And generally that 10% tends to be in the more global wealthy north. And this gap still exists. So how can we shift it? How can we change it so that research priorities are led by researchers in the global south, led and awarded to the researchers in target settings where we actually need to address these disease burdens? And what's happened is, to some degree, silos of excellence have developed around perhaps a particular disease or product. And the problem with that is it doesn't tend to spread the expertise within an organization more widely, from perhaps one department to another, or if based in a hospital, from one ward to another ward. And that therefore fails to leave lasting, capable teams and doesn't really help to strengthen the research infrastructure within that institution. And what we've also got is research is changing really quickly. It's changing in terms of the more conventional way we run studies, from observational through to clinical stages 1, 2, 3, in these quite linear steps, to more adaptive designs. And regulators are working with teams and organizations to much more efficiently register products more quickly. And the real danger is that lots of disease areas will be left behind and people will not be equipped with the skills to keep pace with this ever-evolving research landscape. So whatever disease you're studying, we need many types of different studies to address the various questions within that field or within that discipline. And so whatever your particular study that you're doing needs, there has to be a research cycle, and that includes component steps from the study design all the way through operating that study really well. So whichever the disease focus might be, the skills and the areas needed to perform research really well do not differ. And we could make some really huge progress if we actually share the skills, share our methods, look at the resources we can share between teams, but also between organizations. And again, that cross-linkage across different disease areas, so that we learn the skills for setting questions, running our research laboratories, how we handle our data, analyzing our data, but also, very importantly, engaging with all our communities. Now, what we try to do is look at how we can maybe invest in building research capabilities overall, with a big aim of research being embedded into healthcare provision, and looking at how we can maybe connect up research with healthcare delivery more formally, more structured, and realizing that factors that affect research or make it difficult doesn't actually differ. And that's where we can potentially target our efforts. So how do we ensure that knowledge is effectively transferred? Now, in this context, what we do is we host communities of practice, and these are groups of practitioners or experts who perhaps experience the same challenge, but also share their know-how and their tacit learning to solve that problem. And in doing so together, they solve it much faster. So what we wanted to do is take that philosophy and create a community of practice in healthcare research. And so what we've done is we have created an online platform that works in combination with teams in the regions through their different studies and collaborations. And that enables this shift in expertise from these potential disease silos much more broadly into research organizations and healthcare settings. So this encourages more research to happen in any one given setting. And then what we do is we host a number of different member hubs, which could focus on various disease areas or topics, maybe from Zika virus through to different disciplines within research, looking at data management, and we collect these member hubs all together in a science park format. And through the active driving of this community of practice model, we can enable knowledge transfer between the different diseases and networks and countries. So at the moment, we have more than 60 of these hubs in which practitioners and healthcare professionals and researchers are all sharing their tools and their resources. And these go on to be accessed by much wider and connected scientific communities. So in addition to supporting this and driving this, we also host webinars and workshops. We look at developing toolkits which can be adapted and replicated, and we support research careers through training and different initiatives for professional development. And as a result, we've had more than 3.5 million training courses taken in our online training centre. We've had more than 500,000 documents shared. And through this mechanism, we're trying to work to raise standards and make research a little bit easier and faster. But we also want to ensure people are recognised for this active sharing. So what we've done recently is we issue DOI numbers, which is document identifiers, to anything that is shared. And so those documents can be tracked, they can be cited, and there is true recognition for the author and the contributor. So to support a sort of a more fair and scalable approach to this, the Global Health Network has established a more federated and decentralized partnership model. And what that means is that many regional and country centres exist across the globe, hosted by different partner institutions, but with some coordinating centres based in Latin America, in Africa, and in Asia. And it's a franchise model where groups and organisations, they can be a part of the Global Health Network, they can contribute directly to the library of tools and resources themselves from their own studies, from their own experiences, but they also have access and can deliver training or resources locally in their setting, which they've discovered or sourced through the platform. So everybody benefits from this scaling approach of sharing methods and tools. And it allows groups, potentially even institutions, to operate more autonomously, to win funding, to address their local research focuses and capacity gaps, but also be connected with each other and working to shared standards and processes in order to maintain quality. And obviously quality is very important to everybody. And last year we were designated a WHO collaborating centre. So what this means is we share the philosophy of the science division within the WHO to connect health research with healthcare delivery. And we'll be working to facilitate the embedding of research skills in every healthcare setting. So that's very exciting. So how do we work with teams across the globe to widen the ability to undertake health research? And we've got a few points here. So this needs capacity at scale. And what we mean by this is working with organisations to support research within the institution or your hospital so that there's a very conducive research environment. Now, one of the precise ways we're actually doing this is through supporting Pathfinder projects, which we can talk about a little bit later. But Pathfinder project is essentially an add-on study that maps and tracks the pathway of a host study. in order to help to identify and understand the different barriers and challenges that are encountered along the way of conducting that host study. And a lot of this is about building systems and environments that really enable data science and research to happen. There is a need for tools and systems, a need for training, career development that can help actually support research, enable research to thrive in that setting. And there's a number of ways to support this through resources on the network, as well as thinking more about how we can connect excellence between organizations or different disease areas. Now, working in this federated partnership approach, which we just mentioned, to share know-how and those tools, that really is helping to drive the equity in access to learning. And underpinning this is the need for good governance and trust, working with local communities from the outset in order to put research into place, but also the management and use of data requires a lot of processes to be in position, but long-term fosters faster and more ethical progress. So how could we work together? A lot of the programs we support run in a very practical face-to-face format in universities and hospitals, and they aim to be very inclusive of all the different healthcare professions and all the different professional groups. There's obviously a vast amount of online learning available through the platform, but we also deliver research training in person, and that can be facilitated through supported learning sessions or skills-based workshops. We also host twinning and mentoring schemes that pair sites or small groups of researchers in order to enhance that expertise and bring further equity in where the different skill sets lie. We host research clubs and clinics to help strengthen the research culture, and also use those to hone the volume of online learning and training that's available, especially through the platform, to signpost to those courses and bring some focus to your particular area of work. So partnering with the platform, with TGHN, can really help to access some of these initiatives, they're all available, it's all open access on the platform, easy to deliver and to coordinate. So, what we're trying to do with TGHN is understand that tackling any disease requires this whole ecosystem of evidence. We need to do surveillance to understand the different disease threats. We need to run observational studies in order to characterize the different diseases. We need clinical trials in order to test our interventions and new therapies. Social science, incredibly important to understand the different perceptions or the barriers and the behavioral factors. We've got labs, genomics and diagnostics, which are key underpinning areas of research where it needs to be connected with the public health benefit. Disease modelling, as was highlighted by COVID, and the need for health economics, where research can really bring benefit, where can it bring benefit, and really setting those priorities. And the use of real-world data, which we mentioned earlier, changing really fast. So we need this whole ecosystem. And the consideration for these component steps are required for any one of these types of studies to ensure that the research we're undertaking is safe, it's also ethical, and also it's accurate. So working across these areas, the same skill sets are needed so that any team can tackle the target disease in their community and generate high quality evidence to change outcomes through their research efforts. Just to conclude then, so we know the component steps do not differ between study types or diseases. And if we work better to share these critical resources, these cross-cutting resources, we can drive progress much better and faster, and we can nurture research teams with the ability to be more internationally competitive. And so convening these health organizations with the communities of researchers and study teams really does strongly enable this knowledge transfer between health research and healthcare delivery. and can increase the generation of evidence and the use of that evidence in health outcomes. So I've just used a few more. There's just a few images here of the other member hubs which feature on the Global Health Network platform at the moment, spanning different diseases from different health organizations and across different topics. But please do take a moment if you've not had a chance yet to just browse the platform and see the whole wealth of topics that are available on there. And now I'll hand back to Dr. Hassan. Thanks, Mariam.
Thanks, Bonnie, for a fantastic overview of the network's activities and scope. And I think what's really heartening to see is that how the network supports the entire research ecosystem. We have always, really loved the philosophy of enabling health research, high quality health research in every setting. And research should not be conducted in silos. Research should not be, limited to a few centers of excellence. All places where any clinical activity happens should be able to do research. So enabling research everywhere is perhaps, the central core ethos of what we wish to do in Pakistan as well. So with this, moving on to, our next speaker, Dr. Farah Asif, will be covering the TGHN Pakistan and how Pakistan has become involved in this initiative and what activities do we plan in the future. Over to you, Dr. Farah.
Thank you, Mariam. Good afternoon, everyone. Assalamu alaikum, everyone. I'm Farah Asif from Shaukat Khanum Memorial Cancer Hospital and Research Center, Lahore, Pakistan. And I'm happy to be joined by all of you today. So I hope you all can see my slides. Okay. So today I will be speaking about the Global Health Network Pakistan, giving an overview of its objective and discussing specifically what TGHN Pakistan would be specifically doing and how it would be doing this. And at the last, I would like to cover the topic that how we can connect with you and how we feel your contribution is important to us. So with this, can we move to the next slide? Thank you. So in the previous presentation, we had an introduction of the Global Health Network Pakistan. And as Bonnie Baker has already informed, that the Global Health Network is aiming to enable research in every healthcare setting, and they are striving to shift the leadership, research leadership, to the global south. And in this mission, they are setting up regional hubs in in diverse locations and also in Pakistan. And for this purpose, the Global Health Network is partnering with the Shaukat Khanum Memorial Cancer Hospital and Research Center. And Shaukat Khanum Memorial Cancer Hospital and Research Center would be serving as a coordinating center. So for this, can we move to the next slide? Okay, thank you. So in line with strategic vision and goals of the Global Health Network, Pakistan Center for the Global Health Network is established as a hub to strengthen the country's research capacity development. And while we do this, first and foremost, emphasis is that it is led by local leadership. And to do this, we need to build capacity of research as well as of leadership within our local researchers. So the network's resources and training programs can be leveraged for the national audience by facilitating training initiatives and connecting researchers as well as the research students in Pakistan to TGHN resource database. And these will be detailed in one of the coming presentations, so stay connected with us. It brings the prospects of promoting collaboration and mentorship for researchers. And as we have already seen, that there is a professional development scheme, and this can benefit the researchers as well as research students. Through networking and collaboration, it can support the exchange of knowledge and expertise, and hence it can develop, it can help sharing the capacities within the network. Secondly, we aim to base this work on strong understanding of the needs and challenges of health research in Pakistan. And to elaborate Pakistan context, Pakistan is a lower middle income country where government is spending less than optimal on health. And as a result, our healthcare system is mixed, somewhat fragmented, and it is confronted with many challenges. Like one of the challenges is increasing population and as well as increasing burden of diseases. There is also inequitable access to healthcare. Pakistan is home to national disasters. It is environmental, climate vulnerable as well. If we specifically look at the health research in Pakistan, we have witnessed a considerable growth in research output in Pakistan. However, when we see at the quality of the research or the impact that this research is making, we see that it is not very well established, because research is not often led by local researchers because of the limited capacity and resources. At times, it is not in line with our local needs. And because of this, it cannot be used for evidence-based policy making. As we have already seen, as Mariam has already mentioned, that often it is conducted in silos, often within centers of excellence, as there are limited opportunities which create a sense of competition among the researchers nationally, and who struggle to collaborate because of this competitive nature. There is a lack of collaboration at the national level, and this negatively impacts how we can showcase our full potential of research, and we can attract the collaborators as well as granting bodies. The situation is further worsened by the disconnect between researchers, policymakers, and the public. So clearly we need to do research that is needed by us and that can help our people. The network is fostering partnerships with other organizations and institutions, nationally and internationally, to further advance global health topics and health research. This will help find local solutions to our local problems. And this was as well help meet global health responsibilities that we have. So while we do this, your contribution is very important. Can we move on to the next slide, please? Yes, thank you. So we plan to invite diverse stakeholders like you to participate in our situational analysis of health research in Pakistan. And we want to establish and continue our dialogue and engagement with all of you as important stakeholders in this dialogue. And let's co-create our roadmap to advance health research and build health research capacity within Pakistan. And we can together implement this roadmap, and we can contribute to make this change happen. And for that purpose, your participation is important. So in coming presentations, you would see different resources as well as how you can connect with us. So stay connected with us, and I will stop here. Thank you very much.
Thank you very much, Dr. Farah, for a good, stimulating overview of the TGHN Pakistan page. We now have we actually have polls throughout our session today, audience polls that are meant to capture the thinking process of our audience who has joined us today. So Salvia, shall we start with our first question for today for all?
Yes, thank you, Bonnie and Farah. Excited to be here. I am going to launch the first poll now. We have built-in polls in this session because we want to hear from you. We want to hear your voices, and it will help us in planning activities as well as provision of the resources on the global health network, and specifically on the Pakistan page of the Global Health Network. So I'm just going to, I hope you can see poll 1 on your screen right now. I am just going to read out the question. We are asking you as to what is the single greatest challenge faced by researchers for conducting high quality health research in your country. And we ask you to choose one option, which might be a little challenging, considering we might be facing multiple challenges, but we want to know what, if you could choose one, and what your topmost challenge would be. So we have a few responses coming in. It's amazing. And yeah, we will share the results of this poll soon after. Right, so I hope you can see the responses. I'm just going to quickly go over them, and we'll keep the discussion on that right to the end. So 37% of the participants thought that the topmost challenge was lack of training opportunities to develop research skills, and an equal number also chose lack of funding. Among other choices were lack of research expertise, dedicated time, issues with regulatory or ethics bodies, as well as lack of mentorship opportunities. Amazing. So I'm going to stop sharing now, and this one, and it might also be a good opportunity to move on to the second poll, because the attendance and the participation was so good. Let us move to the second poll. So this is the second question. I'm going to read it out, but it must also be showing up on your screen. If you had a magic wand that you could use for enhancing the capacity for health research in your country, what would you do? And for this one, you can choose more than one. So you can actually click on multiple options. I'm going to read out a few of them, but you can see them on your screen. Refine research priorities, develop leadership, develop centers of excellence in research, culture of collaboration. Wonderful, and we have responses trickling in now. Ooh, we have 79% people already participated in this poll, so I'm going to end it and share the results for this one. You can see it on your screen. We see most of you would provide dedicated funding for prioritized research, super important, and equal number would develop research capacity through training opportunities. And in good numbers, participants thought that defining research priorities would be very important, as well as developing research infrastructure in every healthcare setting. So thank you so much for your responses. I'm going to stop sharing the screen now, and over to you, Mariam.
Thanks, Sylvia. It seems funding and capacity building is a common theme whenever we have run such exercise, with, of course, some really other important areas identified as well. So we'll move on to our next presentation, where I'll just take you briefly through the various ways to connect with the network, with the Pakistan page and its various other resources, how to make use of these resources, as well as how to perhaps share your own work and find collaborators or connect with other collaborators. Salvia's presentation is going to be after mine, and she's going to talk in more detail about some of these resources. So mine is going to be like a bird's eye view of what Salvia would discuss in detail. So I'll share my screen now. Okay, great. As I explained, I'll be talking a little bit about how to connect and collaborate on the network. So the first question would be, we have shared a few details about what the network does and Pakistan's involvement with the network. A question which some people have also asked is why connect with us when there are so many other sources available on the net? And of course, there's some really good resources as well. So this network, as previously Bonnie also shared, is focused on all aspects of the research ecosystem. So not only are there member areas, each with the specific community of practice related to certain disease states or certain conditions or certain aspects of research, but anyone can become a member of those groups or those communities of practice and use that space to work, disseminate their findings and their work and engage with others. Secondly, if someone is looking to develop their skill set in a certain area, there's a vast array of resources to, guide and train and support researchers in all aspects of health research, from their designing and planning and operations to its implementation, community engagement, and even policy making. So that in itself makes the network really unique in terms of its ability to help you in all aspects of health research. And then, of course, there are various ways of doing that. Firstly, you can register with the network as a whole and stay updated on its various activities. Secondly, you can, of course, share your own work in the various groups that exist. You can join trainings, you can be a part of several upcoming events and workshops, webinars such as the one we are conducting today, and also connect with other hubs on TGHN. People who are looking to work with other researchers, they often find it difficult to identify like-minded groups. So this group has several features that can help you do that. We have the site finder, we have several groups with the Connect and Collaborate tool. Every page that you will go to would have some information, an email address of a group coordinator who can connect you with relevant persons. So you have the ability to reach out to nearly anyone that you would wish to connect with. And how you can do that. So firstly, I'll just briefly take you through the TGHN website, just to get an idea on what the network is and the scope of that network. So the network has two main components: knowledge sharing hubs and the capacity development initiatives. So you have member hubs, which cover, there are nearly 65 member hubs right now, and they cover a vast array of disease areas and research interests. So we have data science, we have the congenital anomalies network, the COVID-19 network, the Africa CDC, clinical trials networks, global health bioethics, pandemic planning. So there's a vast array of conditions and interested groups that you could connect with throughout these member hubs. So other than that, you also have a very interesting feature of this particular hub is the fact that you can actually view things in local language. So for instance, if I wish to maybe see something in Urdu, for instance, I can just simply translate the basic information for me. So even language is not a barrier on this hub. You have the ability to even translate information in any local language. So there are many translation options on this hub as well. And then registering with the hub is a very simple process. So all you need to do, so I'm already logged in. Let me just simply log out. Yeah. So what you would need to do is that you would need to just simply click on the register button and provide some basic information. And it's as simple as 1, 2, 3. It doesn't involve a lot of time. It doesn't involve a lot of data on your part, and you will be registered with the network, and you'll be able to access all resources that are there free of cost. So in addition to that, if I can, take you back to my presentation, there are several research tools as well. So, so within the research tools, there's a resource which is called a site finder. Again, a free open access tool which can link research sites to various collaborators. So if we click on it right now, we can simply and if I wish to maybe look at the available research sites, I can get a directory of all registered sites across the network, and there are many. And I can even do an advanced search according to disease areas, the available clinical facilities, the regions within which they exist, and then search them accordingly if I need to look for partners. Other than that, there are some really interesting tools, such as, there's a data science hub. If you click at that on that particular hub, and this is a tool that is available on many hubs, and we also plan to include this in the TGHN Pakistan page. There's a connect and collaborate tool. And each hub or knowledge exchange or community of practice has its own registration page as well. So if you want specific information related to that community, you can register with that particular community as well. And then if you want to just like collaborate with people, there's a connect and collaborate tool with a very interactive map, which gives you information about people that are existingly available on this map, and also allows you to add yourself or even remove yourself if you would change your mind later. So there are several ways within which you can engage with the network with a vast array of resources that that are available for all of you, free to use. And I would just encourage everyone to explore the network and maybe look at communities that are of interest to your area of research and connect with them. A very unique feature that Salvia is also going to be covering in some detail is the fact that if you share your work, it would not be without credit. So any work that you share with us can lead to a DOI generation. So there's going to be a DOI linked to whosoever uses your work. So you will be actually opening yourself up, but also in the process also getting recognition for what you open yourself up to. So DOI is a digital object identifier. This is a specific thing that is issued for publications, but this is also linked to any tool or any resource or any specific SOP or any document for research use that you put up on TGHN for others to use. So I would just end here. And if there are any questions, we can take those up at the end. I see there's some Q&A comments in the Q&A section. I'll try to get on to these. So we'll move on with our last presentation. So I'll invite Salvia to introduce various resources on the TGHN.
Thank you so much. Thank you so much, Mariam. That was a wonderful presentation. Thank you for walking us through the vision for the Global Health Network Pakistan and how to stay connected. I am going to be presenting and give a broad overview on the different training and professional development resources that are available on the Global Health Network platform. So you can find what you need and get the skills in order to get started or grow in your work as a researcher. First up is the Global Health Network Training Center, which is a central hub for all of your research, training, and professional development needs. It hosts training materials put together from all of the Global Health Network, collaborating organizations, institutions, and networks. All the training center resources are free, open access, and they are fully online, and they are mostly in the format of e-learning courses and resources. The courses on the training center cover every step, process, and issue in conducting high quality research. They are all peer-reviewed, regularly reviewed and updated. After the completion of the courses, the participants are issued with a completion certificate. The new courses are added and notified. If you are registered on the hub, also signed up for the newsletter for the training center, you get regular updates on new courses being added. If you have any material which you feel would make a good e-learning course, please contact us and we can put you in touch with the training team which helps put the courses together. A little bit about the resources that are also on the training center. They are guidance articles, tools, templates, and example documents to help researchers. Also includes links to online resources from other organizations that are either available online or either free or at low cost. Some of them are disease specific, but most of the content can be adapted. And as Farah shared, if you share a resource from your study or any work in research, you are issued a DOI. We also like to call it a digital fingerprint, which can track your work online, and it lasts beyond the lifetime of a journal or an online platform. So it can help you highlight your work while you're also sharing it with others to benefit from. We have toolkits on the platform. You can find the toolkits in the navigation ribbon of most of the hubs. Toolkits are stepwise and how-to guidance to many research processes. They can also be used as resources to support the implementation of research capacity building activities in your team or institute. So for example, there is a toolkit on how to set up a research club. And a very new and a popular one based on high demand is a toolkit on research proposal writing. The Global Health Network platform hosts past and upcoming webinars and workshops, so the recordings and materials are made available and updated regularly. They span research disciplines, regions, and therapeutic areas. Study profiles are documents that can complement your research study, also to support a faster implementation of research studies, shared and open protocols and tools for raising standards and enabling easier and better data sharing. A few examples on the screen here. We have the study profile from the Solidarity trial in Pakistan, and Mariam has shared that the trial is currently and temporarily suspended, but you can find all the study materials to review and reference from. A very unique and wonderful system, the professional development scheme, is to track your career in health research by creating a profile. You can add your qualifications and your training in your profile. You can score yourself on different competency areas and update it as you move along in your career. It also creates a professional CV for you that you can keep with yourself and print it for use. It records, tracks, and guides professional development in health research. It is based on the Global Health Network TDR Global Competency Framework, and it covers all competencies that are ideal for a research team to conduct a successful study. You can find more about it on the training center. This is also within the training center on the Global Health Network platform. And the last one that I have is the Resource Gateway, which is a tool to search for resources on the different themes, regions, and diseases. It's like an entry point to a whole suite of resources which are free and open access. You can see it's like a wheel, and you can select a segment to find relevant templates, databases, and guidelines. I have a few screenshots. I chose data science in the research cycle, and then evidence into practice, and then within toolkits. And these are the options that were made available based on what is currently available. But please know this is being developed, And if you do not find anything on the resource gateway, you will find it on one of the knowledge hubs. So you can check them out as well. So that was on the Global Health Network resources. I hope that encourages you to check the platform and to explore the resources on your own and share yours as well. Thank you. I will stop sharing and move to the next poll question, if that is all right with everyone, because this is related to the presentation. I hope it has come up on your screen. We are asking, what Global Health Network resource would you like to know more about? Amongst the ones that were presented today, you can choose more than one option here as well. And I see responses coming in. Here are the results. I hope they are showing up on your screen. Most of you would like to know more about workshops and webinars. Second is professional development scheme. And third on the list was the training center. Wonderful. Over to you, Mariam.
Great. Thank you so much, Sylvia, for an excellent presentation. I think this was very helpful for everyone. And I see that there are many questions and interests around that. If I can, quickly ask Bonnie to answer two questions that have been unanswered so far. One is if there is any specific site working on chronic respiratory diseases, and if there is, a specific group that looks at biotechnology related work. If you know of that, perhaps we can, share that information with them.
Yeah, certainly. And I'll do my best to try and think through the 65 that we've got so far in order to answer that. But in terms of respiratory, we do have the dedicated COVID hub, which links out to other groups which are studying and running different research programs in respiratory illness outside of COVID. And in terms of biotechnology, I don't know if we have a biotechnology specific hub at the moment that features throughout quite a few of the different network hubs within their core research programs. But we do have specific hubs in terms of global health bioethics, and one which is building around biorepositories. So again, if you just have a look on the homepage where Mariam was indicating that we've got the listed tiles with the 65, there's a whole breadth with, and each member hub has just a short synopsis to give you an indication of the research focus or the theme of that hub. So that's a really great starting point for anyone who wants to find anything specific.
Great, thanks. Another question which I did answer in the Q&A section as well, but if any one of you can elaborate a little bit on that, is that how can TGHN be a helpful resource to bring local researchers together, or what has been the TGHN experience on building, the national research capacity or research that is relevant to local needs? I know this is a very loaded question because TGHN has had a lot of experience in this, and there have been many mega projects. But if you could, share one or two examples related to your work in LMICs, that would be very helpful for everyone.
So shall I jump in first, and then Salvia can always add some more examples as well. So I think one really great way that we've been able to work with lots of different groups, lots of different institutions, is through training efforts, which seem to be indicated in the poll that would be very interesting to a lot of people on this call. And so there's different ways we do that. We obviously have the online training center, which, if you'll get a chance to explore, covers a lot of different research skills. So generic skills, basic skills that overlap nicely with that ecosystem of research that we were talking about earlier, in the different component steps for that, right from how to design and conceptualize your study and set your research question, community engagement throughout your operational side of your research from start to finish, all the way through to sort of, reporting and administrative steps, etc. Then we also have specialist skills and more modular courses on the training centre as well. Again, within different fields of expertise that might be of interest to professionals as well as the student groups. I think a lot of people have been asking about in the chat. And then what we've done is also set up with people who are very interested to do so, some practical sessions in the institutions for groups. Again, we try to be as inclusive of all healthcare groups, nurses, lab technicians, everyone who's involved in research, in order to really engage all the different positions and roles that make research happen, but also make research happen effectively. And so we run different types of skills workshops depending on the target focus that people want to explore. We look at how to sort of set up supported learning sessions, which is time with a computer, as well as a tutor. So someone might come in and give a short seminar or a short lecture on a particular topic, maybe reflecting on their own direct experiences through their research as a PI or perhaps as a research lead. And then time is given to complete the affiliated or complementary e-learning course that's available on the platform to support that session. So there's lots of ways that we try to bring in training, coordinate some training that requires more people's just time and engagement. The training available through the network is free. And also we welcome anyone who wants to come forward to actually host a practical in-face workshop with us. I know sometimes there's some costs associated with venues in order to run one-day workshop programs, things like that. That's something we're very willing to partner on and support. So in terms of bringing training or training examples together for groups, that's widely available across lots of our research programs and with lots of our partners. In terms of also trying to help people almost establish a bit of a learn by doing, which is obviously what a lot of the network resources are there to do. It's put it into practice. That's the best way to learn is if you want to do research, do research. And one of the greatest hurdles for that, as we all know, is funding. And so what a great sort of aspect of the network is, which Mariam touched on in her presentation, is how you can actually find collaborators, how you can find other groups, maybe with the skill sets within the field of expertise, within the disciplines you're interested in collaborating with. That might be within your own, it might be multidisciplinary for a more collaborative project, might be across different countries. That is a really, really wonderful function of the network, is how we are able to bring groups together to form collaborative grant proposals. We also offer our own support within the operational team to help those groups come together, help find funding opportunities, and help to put those proposals into action. So that's just a couple of examples from me. Salvia, please do chip in, or Mariam, if I've said anything that also inspires other ideas of things to mention, please do say.
Yeah, no, I think you have covered the gist of, various things that the hub can offer locally. Salvia, do you have something to add for this? Perhaps ways via which people can, connect better locally? The hub.
No, I think Bonnie covered everything. We could move to a little bit of discussion because there's so much engagement in the chat. Farah or Mariam, would you like to maybe raise a few of them so that we can discuss a little bit?
Yeah, I think one thing that we can perhaps cover is that, there are many international groups and hubs available throughout the network. If we talk specifically about Pakistan, how can the Pakistan hub help the researchers within Pakistan to come together? I think each hub represents a region. The Global Health Network has several regions, several regional hubs, like there's an Asia Knowledge Hub that Pakistan is a part of. And then we also have the Latin America regional hub, and then we have the African hub. So each, knowledge hub that exists represents a certain region. So for the Asia region, We have, people from India and from Sri Lanka, and, with, the hub being led by the team from Bangladesh, DDRB, and then also Pakistan has joined in. And I think we also have a team from Nepal. So there is a possibility for the region to come together via this hub, and also from people within Pakistan who could express interest through registering on this platform, and perhaps indicate areas that they would like to work on. And this, and of course, we will continue to hold, and this is just an introductory sessions, but in our forthcoming sessions, we plan to also bring together people from within Pakistan who are already working on this. For instance, one of the future works that Dr. Farah had shared was, our plan to map, capacity for health research in Pakistan, and to look at our existing challenges and what our existing capacity is. So there are people from Pakistan who have already done some work on this. We have a Pakistan Clinical Trials group. There are members of that group that have done some, really good work related to our existing capacity. So in our upcoming webinars, we plan to, give these people some space so that they can share their work. And it is through this engagement and interaction within each other, I think it is that engagement internally from researchers within Pakistan, we are going to be able to generate effective research platform and consortia and perhaps disease-specific groups. And I realize that there are many that already exist. Like Dr. Natasha had mentioned, the Infectious Disease Society of Pakistan, and that is very active. And then also, we have, the Anesthesia Society of Pakistan is very active in research. There are other research groups as well. So we invite everybody, and we feel that by having a single platform where everyone shares their work, we find opportunities to continue to engage with each other and perhaps develop avenues for working together. I think we have covered most of the questions that were raised in the chat box as well as in the Q&A session. I would like to, invite Dr. Farah to perhaps share, in line with the poll results that we just captured, share some of the work that we'll be doing further related to, our mapping and capacity assessment and further initiatives. So over to you, Dr. Farah, and we can share some deep updates with everyone.
Thank you, Mariam. So as in the discussion and from the chat, we have been seeing that there is a lot of interest in capacity building activities. At the same time, I think it's Dr. Natasha who has already shared that maybe the first step would be to identify the challenges. And I would like to inform her and everyone that that's going to be our strategy, because the Global Health Network would be, as we have initially said, that it is going to be led by local researchers in Pakistan, as well as we aim to do needs-based research. So we need to identify our needs. So this is the second session that we are doing with the Global Health Network. In the first session, we have tried to collect the challenges, and through polls and the discussion today, we were able to identify a few challenges, and this knowledge is not new. We already knew the challenges. We already knew that the research is limited by the limitation of resources as well as the capacity, because of the lack of training opportunities and as well as its funding. So these are major problems that we have been identifying so far. So and we have already discussed that the research is often being conducted in silos, and that's the aim, that we come together as a research community of Pakistan, and within us we can of course have established working groups or thematic clusters who are working on certain specific thematic areas. So this is the plan. And for that purpose, in the next webinar, we would be in the next webinar and in next engagement, we would be reaching out to you as you are the stakeholders, and to formally do our needs assessment. And while we do our needs assessment, we would also like to hear from you that how you see is the best way to address the challenges that we are identifying. So this is like starting a journey together. And of course, we will be in touch. And that's the whole idea of having this platform and having this Pakistan Hub. So, stay connected, and we will reach out to you for this needs assessment activity, as well as for diverse training activities. As I could see from the chat that there is a lot of appetite for the training resources. And while we join hands, we identify that there is a wealth of training resources which are already there, but we can always identify and develop the trainings which would be as per our perspective and as per our needs. So, and we can do that. And this platform gives us a freedom to do that. All of us can join together and identify our training needs, and as well as develop some training resources to address those needs. And that's the way forward. And I'll stop here. Thank you.
Thank you so much, Farah. And I think that so you put it quite wonderfully that before we can start specific capacity development initiatives, it's important to firstly identify our needs and where we stand. And that's what we plan to do as step one, and then take things from there. Thank you so much, everyone, for your wonderful participation in this webinar and for being such an engaged audience. Thank you to all the panelists for sharing their insights with us. We have received many comments and questions, and we have tried to answer most of these, but any that remain unanswered, we'll request our panelists to share their responses, and these details will be available with the webinar recording for all of you. The webinar recording will be shared, and it will be available for later use by all. And once again, thank you everyone for your participation, and with this, we will now close the webinar.
Thanks, Mariam. Thanks, Farah. Thanks, Sylvia. Thanks, Louis.
Everyone. Thank you.